Today we're here to talk about something that to some degree affects every person in this room. Young, old, male, female, rich, poor, all cultural backgrounds and any religion. Something that can have very serious long-term consequences on our physical body, our emotional well-being and our relationships with others. We're talking about something that is often not spoken about. Whether it's affecting you or somebody you know, you may not be sure how to say it or what to say, or you may be worried that if you do say something, you may somehow make the problem worse. Have you ever felt uncomfortable or awkward in your body or clothes? Have you ever looked in the mirror and felt ashamed, self-conscious or anxious about the way you look? Have you ever compared your body to your friends? Have you ever gone on a diet? Have you ever felt you would be happier, more popular or more confident if you lost weight or changed the way you look? I'm guessing that almost all of you answered yes to at least one of these. Studies show that body concerns are the #1 issue currently affecting young people. It's normal, particularly during the teenage years, to experience concern about your body on some level. However, very high level of concern also places you at a greater risk of depression, isolation, low self-esteem, obsessions with weight loss and developing an eating disorder. Did you know that 80% of 10-year-olds have been on a diet? 90% of teenagers want to change at least one aspect of their physical appearance, with body weight ranked as the #1 area that they would like to change. What do teenagers your age think would make them happier? Is it close friendships, family relationships, good grades? Actually, it's none of these. 60% of British teenage girls think they'd be happier if they were thinner, and 67% think they need to lose weight, when in fact they're not overweight to begin with. Does that surprise you? Did you know that dieting is the biggest risk factor for developing an eating disorder? 25% of dieters progress to a full-blown eating disorder. You are 12 times more likely to overeat, something professionals call binge eating, if you diet frequently. There are at least 1.6 million people in the UK being treated for an eating disorder. Considering most people wait, on average, 7 years before seeking treatment, this figure should probably be a lot higher. Of those who do develop an eating disorder, 1 in 10 will be male. So why are we here today? Well, one of the best ways to protect ourselves from developing an eating disorder and just generally feeling bad about our bodies is by being aware of the things that influence the way we feel about ourselves. So today, we're going to talk about eating disorders and body concerns. How do you know when normal body concerns develop into something more serious? We'll bust some myths about eating disorders. Who gets them and why do they develop in the first place? What are some of the long-term consequences associated with eating disorders? We'll also explore the power of words. How do the words we choose to use about our bodies, shape, weight, food or appearance influence the way we feel about and view ourselves and others? What do we mean when we say we feel fat? Do you engage in fat talk without even knowing it? And what about social media? How many likes did your last selfie get and how did it make you feel about yourself? You guys are not just reading or looking at different types of media, you are actively creating and sharing it through Twitter, Facebook, Instagram, Snapchat, YouTube and Tumblr. With such an influential tool at your fingertips, how can you use social media positively, creatively and responsibly? And what about the concept of attractiveness itself? We all have this idea of what is beautiful, what is attractive, of what makes up the perfect body. But who determines what is attractive? We'll take a look at the tricks and strategies that are used behind the scenes of magazine shoots and advertising campaigns to produce the unrealistic images that we're bombarded with on a daily basis. How can we stay media smart when it comes to how we feel about ourselves and our bodies? And finally, how can we help look out for one another? If you feel you or someone close to you might be struggling with negative thoughts and feelings about their body, or that they may be suffering from an eating disorder, what do you do? Who can you talk to? Where can you go for help? And what does getting help look like?